Thank you for the work that you have done to create awareness about the food we eat and how it affects our health, particularly with our children. And you have helped put that on the American agenda, rightfully so, and I appreciate that. I want to share with you a few statistics. According to the CDC, obesity prevalence is around 42% among adults with lower incomes compared to 31% among higher income individuals. That the relationship is strong among women. 45% of low-income women are obese compared to 29% of higher-income women. And I know I have had this conversation over the course of my public service career many, many times because at the states we run the Medicaid program, that it impacts those health statistics, that obesity impacts our programs, the cost of them, the quality of life of the people who are served. And I also get this question about why in the world does the federal government continue to subsidize programs that lead to unhealthy foods, and why do we operate programs in the way that we do, like with SNAP, that pays for foods that we know are causing people to be unhealthy? And I know you don't have the sole authority in this matter. The Department of Agriculture and the Congress is certainly it has an impact on that. But could you just shed some light on how you see your role in trying to impact that? Because we see that these policies are disproportionately affecting poor people, and the inability to change them and make America healthy again is having a disproportionate effect not only on them, but the cost of all of these programs we're trying to maintain.
I mean, the first thing, Senator, thank you for the question, Senator. It's the NIH has been diverted into away from studying the etiology of chronic disease. So there's almost nothing at NIH, very, very little, a low percentage of its budget, a $42 billion budget that is devoted to finding out why we're having this obesity epidemic. We know it's an environmental toxin. Epidemics are not caused by genes. That genes may provide a vulnerability. You need an environmental toxin. Why aren't we devoting science to finding out what those toxins are and then eliminating them? And, the focus is on infectious disease and we almost altogether ignore chronic disease, which causes 92% of the deaths in this country. And during COVID, we had the highest death rate of any country in the world. We had 16% of the COVID deaths. We only have 4.2% of the world's population. No country did as poorly as us. When you ask CDC, why is that? They say because we are the sickest people on earth. The average person who died from COVID had 3.8 chronic diseases. American blacks were dying from COVID greater than almost any population in the world, about over 3,000 deaths per million population. The only people worse are Indian reservations, which have an even higher rate. And the only person who did worse globally were Samoans. We had the American blacks were disproportionately impacted because they disproportionately have diabetes, obesity, cardiac illnesses, and other chronic disease. We need to start studying those, and we need to get rid of the conflicts in the agency that obstructs those studies, and that are focused on advancing the mercantile interests of the food industry and the pharmaceutical industry rather than the health of the American people.
Well, I would ask you to take, if confirmed, to take a leadership role across the agencies to advise us on what policy changes we must make to both not make it worse, but to make it better. Because we subsidize, literally, we have policies as a government that encourages the production of foods and the sale of foods to particularly our poorest Americans that lead to these problems. We are literally creating the problem that we're trying to solve, and your recommendations would be very much appreciated.
We already have liaisons with the USDA, with Brooke Rollins, so that we can, with whom I have a very good relationship, so that we can work collaboratively to reduce the chronic disease and the exposures that are causing them.
Thank you.